Could you tell me a little bit about Medicaid and the changes that have taken place in Medicaid over the last few years?
Absolutely. Medicaid is a cooperative federal state health insurance program for low-income people and for some people with disabilities who qualify on the basis of their disabilities. And Medicaid is a huge insurance program. Almost 75 million people are covered by Medicaid, and that is about 35 million kids. So 1 in 5 adults and 1 in 3 kids is on Medicaid. You know, the majority of people who are in nursing homes have their care covered by Medicaid. The Affordable Care Act was signed into law in 2010, and it included an expansion of Medicaid that included every American citizen under 138% of the federal poverty level. This was just a revolutionary public health and public service type of measure. As of right now, about 15 million more people are covered by Medicaid, but not as many as should be.
And why is that?
The Affordable Care Act was subject to attacks right out of the gate. It was attacked at the legislative level, but also there were literally dozens of lawsuits filed. And they varied in seriousness and threat level to Medicaid. But the most important one was filed by a number of state officials who argued that it was unconstitutional to make states take Medicaid for this new group of people. The Supreme Court sided with the states. They said it was unconstitutional to require the states to expand Medicaid on threat of taking away their federal funding. It basically made it optional. And what that means in practice is only 33 states, including DC, have expanded Medicaid. That leaves the rest of them without having expanded, and millions of people who should be covered.
So how does that affect people's lives, and why does that matter?
It affects people because these are people from state to state who look just like the lucky states. These are working people. You know, 1 in 8 Medicaid beneficiaries in the expansion category is in a working household. The kind of people affected by the expansion are a 56-year-old woman who had odd jobs all her life, most recently was a school custodian, lifted something, injured her arm, and there she was. She couldn't work anymore. Now she's trying to find a job. She's not disabled enough for disability insurance, and she doesn't have any way to get health insurance. With the expansion, she does. So in, say, the state of Massachusetts, she's covered by Medicaid. In this state, she's not.
And what does your organization do to help these people?
The shape of our work varies so dramatically depending on the administration. I've been at the National Health Law Program through the George W. Bush administration, through the Obama administration, and now the current administration. And our work goes back and forth between proactive and affirmative and defensive and, sort of battening down the hatches. The most recent thing we've done is file lawsuits to defend some aspects of the Medicaid expansion. Kentucky had an incredibly successful Medicaid expansion. It was a public health success. Tens of thousands of people got preventive care, got breast cancer screening, got colonoscopies, got the kind of preventive and screening services that will keep people healthy in the long run. The governor came in and wanted to get rid of it, but instead he said, well, if the federal government will let us require people to work in exchange for getting Medicaid, then we'll keep it. The lawsuit argues that Medicaid is an insurance program. It's not a work program. And you don't get to change the nature of Medicaid just because you're the president and wave your hand and say we want it to be this way.
What can people do to support more people getting health insurance?
If people care about this, they need to vote for the candidates who will protect it. But they also could help by explaining to people that the Affordable Care Act is not really what a lot of people think it is. The most high-profile aspects of the Affordable Care Act, unfortunately, are the marketplace and the purchase of insurance and how expensive premiums are in some states, partly because of problems created by the federal government, but also, by sabotage, basically, but also just the nature of private insurance. With the Affordable Care Act, from the very beginning, there was no opportunity to adjust or to fix or take into account the factors that made premiums rise. And there are legislative fixes and administrative fixes that can help address that, but not when half of the governing body is trying to get rid of it and to make it look as bad as possible.
All right, thank you very much.
You're welcome.